at 351-5358. That's 351-5358. And don't forget, we also do men and children's cuts too. 351-5358.
Hello, gorgeous.
All right, 21 minutes after 11 o'clock. Thank you for tuning in. Robin, I just have a personal question. I know that your son had a thyroid condition, right?
Yes.
At what age was he diagnosed?
About 24, I think.
24. So he was already an adult.
Yeah.
Dr. Andrew J. Bauer is on the phone. He's going to talk about the symptoms and risk factors of pediatric thyroid disease and how parents can take steps to detect them. Dr. Bauer retired from the U.S. Army after 29 years of service. Wow. And two combat tours to Iraq. And he's also the medical director of the Pediatric Thyroid Center at the Children's Hospital of Philadelphia. What an honor to be able to say hi to Dr. Bauer. Plus, he's going to give us some great information. It says here January is Thyroid Awareness Month, so I guess I'll just mention that, although you'd want to be aware of your thyroid all year long. Mm-hmm. Dr. Bauer, good morning, sir.
Morning, Larry and Robin. Thanks for having me on the show.
Thank you, and thank you for your service, by the way. Where are you right now?
Just outside of Philly, on the New Jersey side.
And so you were spared, right? You didn't get the snow today, right? That area, or did you?
Right. We had a little snow, just enough to make traffic and travel a little bit crazy, and the kids are off from school, which they're happy about. But we didn't get beat up like, our neighbors to the north of us in New York and Boston. So.
Robin's son he has to continually do something, right?
With medication.
With medication, yeah. So he was diagnosed, as Robin mentioned, in his mid-20s. Tell me about the symptoms and the risk factors for children. What age are we talking about?
Well, kids can develop thyroid problems and can be diagnosed all the way from birth all the way through, young adulthood into adulthood. So all kids in the United States are screened for hypothyroidism, and it affects about 1 in 2,500 kids, so it's relatively common. And then for people that are born with a thyroid that was, functioning normally but acquired hypothyroidism, maybe that's what Robin's son developed, that can happen anytime during teenagehood. It's more common as we go through our adolescent years and young adult years to develop autoimmune hypothyroidism. That's the most common, which is goes by the name Hashimoto's, named after the Japanese physician who described it, or hyperthyroidism, which goes after the Irish physician's name, which is Graves' disease. So those can happen before teenagehood, but more commonly in teenagehood. And then thyroid nodules and thyroid cancer, which again most people think about in adults, but they are things that can develop in kids, and interestingly, similar to adults, it is one of the cancers with the greatest increase in the number of diagnoses each year. We're not sure exactly why that's happening, but we are observing it in pediatrics just like our counterparts as far as physicians are observing it in adults.
When the thyroid is removed, if it is, I don't even, forgive me if I'm even asking a dumb question, but that's just me. But I mean, if it's removed, is there an artificial way to give the body the substance that the thyroid produces?
Yes. So most of these conditions can be medically managed, and thyroid hormone replacement, we call it thyroid hormone replacement therapy, which is levothyroxine, is a pill. It's once a day. It's very stable, has a long half-life. So it's of many of the medical conditions, it's one of these that it's still you have to remember to take your medicine, but it's only one pill once a day. There are no suspensions, even for newborns. It's just not stable as a solution. So it's a pill once a day. It's weight-based. So as kids are growing up, we have to follow their labs, make sure we keep their numbers normal, and adjust the dose to make sure that we keep up with it.
Is the thyroid test given every time a child comes in to see the pediatrician for their physical, or is that something the parent has to ask for?
You'd have to ask for it. So the things that we encourage, families to do, and then physicians to look for. So thyroid during pediatric age is important in the first, actually before babies are born up until about age 3. It's important for not just physical development, but brain development. That's why we screen all newborns so we don't miss that and start treatment as soon as possible if the condition is there. But then just going in for regular appointments, annual physical exams, sports exams, camp physicals. They check their height and their weight and their heart rate and their blood pressure, and they put them, on the growth curve, and just follow, make sure that they're growing normally. And then the thyroid exam is actually quite easy. So the thyroid gland sits just under the skin. It's above the collarbone and below the Adam's apple if in a male, but the same landmark is there in women. It's just smaller. And if someone looks up at the ceiling, you shouldn't be able to see the outline of the thyroid. And the thyroid is shaped like a butterfly or an H.
You should not be able to see it.
Correct. If someone looks up and you can see that outline, that means that their thyroid's enlarged. And then from there, you could look at the signs and symptoms and risk factors and decide
I just
if
passed
you
the
need to
test.
get a blood test.
Sorry, I just pulled my head back. And Robin said I can't see anything, so I passed the test. Sorry.
Wait, see how easy that was?
Are you okay with taking calls from listeners?
Sure.
Good. We do have a listener calling in. Good morning. Thank you for calling. You're on the air with Dr. Andrew Bauer.
I really didn't have a question for Dr. Bauer, but I had a question for you. I don't know if this is the wrong time.
Yeah, it is. You have to call back later on. Dr. Bauer, we always think that the thyroid is what controls our metabolism. Is that right?
Yeah. So as I mentioned, part of it early on is kind of brain development, and then through pediatrics is growth and development as far as physical growth. And then it can control metabolism to some degree. So it controls our heart rate, our blood pressure, our warmth, are we warm all the time or cold all the time, and how well we use calories. So it can control metabolism. It gets a little bit more blame than it should probably for weight. If you're hypothyroid, it certainly doesn't help, and you can gain weight. But diet and exercise is still a critical part of trying to figure out why patients may be gaining weight when they're, otherwise trying to lose it or stay healthy.
But aside from that, what is it, the primary function? What does it do?
Outside of growth and development in adulthood, it has to do with heart rate, blood pressure, temperature balance.
Oh, it's very important.
Yeah, it has an impact on women's menstrual cycles. It has kind of this underlying, as you describe it, metabolism, but it controls many aspects of our daily function that you otherwise wouldn't think about.
Oh, wow.
And it's actually quite common and very treatable.
So if a parent notices that their child is having trouble sleeping or they seem to have low energy, is that one of the symptoms? Is that one of the signs?
Yeah, it's the signs and symptoms, there's a lot of crossover, but if you start to add them up and, these things otherwise weren't there before, then you start thinking that the thyroid could be involved. And it's a very easy blood test to look for any abnormalities.
Oh.
And so on our website, or you can find it in other places, but on our website, if you go under hypo or hyperthyroidism, we list the signs and symptoms. So are they, sitting around more than usual, less energy, less active, they're cold all the time, their hair is dry, their skin's dry, they're constipated. All those things are not uncommon issues, but if they have that and that wasn't their usual state, and you have them look up and their thyroid looks large, then you start to add up, the suspicion that maybe the thyroid is involved, and then getting a blood test is very easy to figure that out.
Wow.
Doctor, we have about a half a minute. What's a good website to send our listeners to?
So they go to our website, which is www.chop.edu/thyroid, and CHOP is CHOP, Children's Hospital of Philadelphia. So chop.edu/thyroid.
All right.
Or Google the CHOP thyroid. They can make it to our website for more information.
I wish we had more time. You're fun. I was having fun with you a couple of points there, and good information. Dr. Bauer, thank you so much, and stay warm. We'll be right back.
Fox News Radio, I'm Lillian Wu. Parts of the Northeast reeling from the first major storm of the year.
11 inches of snow in Boston, but this thing ain't over. We could get, in parts of Massachusetts, as much as 3 feet of snow. In this state and in this city, this still could be a record breaker.